If you're about to watch this patient consent video, congratulations. You've been found suitable to proceed for laser eye surgery. This presentation is to help our patients understand the procedure we have chosen for you today. Please make a note of any queries you might have for us to answer later. Of the many thousands of LASIK procedures performed at our laser eye centre, the vast majority of our patients achieve a dramatic improvement with perfect or near perfect vision. But like all refractive procedures, LASIK is considered to be elective surgery. This means you're choosing to have surgery because you want it, not because you need it. So you need to be sure your expectations are realistic. Keep in mind, refractive surgery may not be as accurate as a well-prescribed pair of bifocals, multifocals or contact lenses. And your decision to have LASIK requires you to weigh up the advantages of this procedure against glasses or contact lenses. LASIK is now the well-established procedure of choice worldwide to correct most refractive errors. Laser vision correction was first performed in Hamilton in August 1994. This precise eye surgery uses scanning laser technology to shape corneal tissue. You'll have very little pain post-operatively, apart from a scratchy feeling in the first 4 to 8 hours. Most patients may even see well enough to drive a car the next day. Most patients see a dramatic improvement within 30 minutes of treatment, and we expect about 90% of visual recovery within the first 12 to 24 hours. During the healing period, you may experience visual side effects such as glare or halos around lights. There may also be some intermittent quality of vision for days or weeks during the healing process. These side effects are usually mild and temporary, with the overall risk of having a serious complication from LASIK surgery much less than 1%. Let's have a look at those risks. The most common complication of LASIK is dry eye. In its mildest form, the condition affects the majority of patients and is thought to be more common when dry eye is present before surgery. The most common complaint by the patient is fluctuating vision, which improves after using artificial tears. Only 1% of people having had LASIK have persistent problems with dry eye following the procedure. Occasionally, your eyesight problem may be slightly undercorrected after surgery, resulting in a minor refractive error. This is predominantly a result of variation in patient healing. If this error is minor, it is hardly noticeable. If it impacts on the quality of your spectacle-free vision, a simple enhancement procedure can be performed. If a treatment is needed to enhance the positive results we know this procedure can achieve, then we gladly do the second operation for no additional fee. Overcorrection is less common, and again, if this doesn't settle down to the target vision, we can correct it with a laser enhancement procedure. Overall, the enhancement rate in the clinic for all corrections is approximately 5%. After surgery, it's normal for your eye to want to move back to its original prescription. We call this regression, which we anticipate. But if your vision regresses more than usual, you may consider an enhancement procedure or a thin pair of glasses. From our experience, serious regression affects only about 1 in 300 patients. A small number of patients experience a slight loss of visual sharpness compared to their vision with glasses before surgery. If this loss of best corrected vision occurs, you'll lose the ability to read, say, the bottom 1 or 2 lines of the eye chart. In some cases, the sharpness you are used to returns over a period of 6 to 12 months. Only about 1 in 500 patients experiences a noticeable loss of their best corrected vision. At the time of the LASIK procedure, some superficial cells on the flap can be dislodged, resulting in an epithelial defect. Though usually only a minor problem, with complete healing taking place within 24 hours, such epithelial defects can result in more discomfort than usual during the immediate post-operative period. Some of these cells can be lodged underneath the corneal flap and may very rarely require removal by simply relifting the flap. Much more rarely, when the flap is being created, a problem can occur that the flap is incomplete. Such complications would occur in less than 1 in 500 cases. It may result in postponing the procedure until the cornea has healed. Some wrinkling can also occur in the flap, and although only seen using high magnification, it can occasionally affect the quality of vision when it is present over the visual axis. Just as with contact lenses, some LASIK patients report noticeably dimmer vision at dusk and under poor lighting conditions. This is rarely noted by patients with the usual degrees of myopia and is known as reduction in contrast sensitivity. It is noticed more with people with higher refractive errors. Rarely do these symptoms prevent a patient from night driving, and the majority of patients do not report any night vision symptoms, with significant glare affecting only 1 in 200 patients. Probably the greatest risk during the first 72 hours following the operation is infection. To help prevent this, you'll be given antibiotic drops during and after surgery. In addition, the eye and eyelids are washed out preoperatively with an antibacterial povidone. All the operating instruments are sterilised, as in any major operating theatre, to the prescribed New Zealand standards. We will not operate on any at-risk patients, such as those with poorly controlled diabetes, those immune compromised, or those with active infections elsewhere on their body. The worldwide incidence of infection is very low, in the order of 1 in 5,000. In the event of a very serious and complicated infection, there's a 1 in 4 million risk that this infection could lead to loss of vision. It's comforting to note, however, that only 1 case has ever been reported in the entire world. Inflammation can affect the cornea after LASIK. This condition can cause light sensitivity. The inflammation usually clears with eye drop medications. Significant inflammation occurs in about 1 in 400 cases. LASIK surgery is done on an outpatient basis, with most people returning to their normal activity within a day or two. On the day of surgery, you need to be accompanied to the centre. The entire visit will take about 1 hour, the actual treatment taking only 30 minutes. We begin by placing topical anaesthetic drops and antiseptic in the eyes in the pre-op area. You'll be offered a light sedative to help you relax. In the procedure room, we lie you down and place a stabilising ring on the eye. This sucks onto the eye, which may be uncomfortable, but it's for less than a minute. The intralaser laser is concentrated into a cone, which fits in the ring to create a stable platform to create the corneal flap. Intralase is capable of creating a layer, just 1/10 of a millimetre thick, in a precise circle. When both corneal flaps are created with the intralase, you're then positioned under the microscope lights for treatment with the eczema laser. The eczema laser reshapes the curvature of the exposed bed of corneal tissue. You will have a flashing red light to look at to help keep your gaze steady. Receptors in the laser monitor your eye position and track any small movements. Any large movements, and the laser will stop. The flap is then put back to cover the newly curved cornea, the flap becoming fully adherent in just a few minutes. Once we're happy this first procedure has gone smoothly, the second eye is treated. Once the LASIK procedure is completed, your eyes will be checked to ensure the flaps have not dislodged and that nothing has floated under the flap that may need to be flushed out. A clear shield is placed over your eye to be kept on until the checkup the next day. Our experienced staff will provide you a post-operative pack that includes directions for your eye drops. Another review is planned after a week. But please contact us if your vision is not staying clear or you're experiencing increasing discomfort. LASIK has been performed on millions of people all over the world, and 96% of our patients with refractive error in the low to moderate ranges achieve functional, normal vision. Patients who fit into the high to extreme category of refractive errors can expect to achieve a dramatic improvement in their natural sight, but are more likely to need an enhancement to achieve total independence from corrective hardware. No matter how routine the surgical procedure, the decision of whether or not to have LASIK is an important one, and ultimately one which only you can make. To put things in perspective, keep in mind patients have been treated for over 30 years with older but similar techniques and are still enjoying visual freedom to this day. By changing the curvature of the cornea, we're providing a treatment capable of lasting a lifetime, enabling a lifestyle with no dependence on glasses or contact lenses.